Good afternoon and welcome back to News Desk. Now, you may have heard about the need to flatten the curve in the COVID-19 pandemic, and all measures the government is putting in place are aimed at keeping the numbers at a minimum. With an announcement from the Ministry of Health to embrace tough times ahead and the rising numbers of COVID-19 positive cases, how does Kenya's curve look like? Let's bring in KTN News Dr. Mercy Korir live for us. Dr. Mercy, good afternoon. The numbers of COVID-19 positive patients continue to rise. How does Kenya's curve look like at the moment?
I think, Michelle, the curve in Kenya has not gotten that spike, which everyone is quite afraid of, because with a spike, what that means is that your healthcare system may not be able to handle the influx or the number of people coming in need of healthcare services related to COVID, or people who are having COVID symptoms, that is the upper respiratory symptoms, or those who are getting severely ill. So what we've seen so far is that our numbers have been gradually increasing, but this could be that it's commensurate with the testing that we are doing, because if we were to do mass testing, for example, in the designated areas of Nairobi, Mombasa, Kilifi and Kwale, then maybe the numbers could increase. But so far what you are seeing is that we are increasing our numbers gradually. We have not surpassed that line, the line where the healthcare system can be able to handle the patients or the people who are coming in. So we are so far doing well. That our curve is below the place where it spikes, and it puts pressure on the healthcare system. Now, what we don't understand yet is that, is this a true reflection of the number of cases of coronavirus in the country, or is it that we have not yet identified everyone? So that's how our curve is looking at. So we expect that over these 21 days lockdown, partial lockdown and restrictions of movement that the government has put in place, then we'll be able to go to as many people as possible, test as many people as possible, so that we are able to identify and have a true picture of what is happening on the ground in the Kenyan environment. The other good thing about where we are now is that what we are seeing are our numbers are, or rather many of the people who've been diagnosed have mild to moderate symptoms. That means those in need of critical care, those who are severely ill and in need of critical care, are very few. And the ones that we have so far, the system has been able to handle. Unfortunately, we've lost some, but those who are already there, we are able to manage, bearing in mind our healthcare systems capacity, availability of critical care personnel that we do not have enough in the country. So far I can say that the coronavirus has been very polite and has been very good on the Kenyan healthcare system, as we are seeing currently. So we hope that with more testing, if we do rapid testing, if we do more automated testing, then we are able to find out as many people as possible. Now, the other thing to note about this curve is that every time you make a positive diagnosis, then it means you are 2 weeks late. Because remember that the incubation period of the virus is 2 weeks. So when you make a diagnosis or you confirm a case, then you assume that you're 2 weeks late. So it means you are playing catch up with the virus. So you need to find out as many contacts as possible of everyone that you have been able to diagnose or confirm as having COVID. And then also now with their contacts, if any one of them is positive, trace as many people as possible. So because we are lagging behind a lot in identifying, confirming, isolating cases of COVID, we need to revamp our efforts, put more people on the ground to do contact tracing, do more testing, and do it quickly if we are able to catch up and close the gap of at least 2 weeks that we are, or we should be working with when we do our projections. But so far, in terms of the curve has been gradually growing. We are able as a country to manage the numbers that we are seeing with what we have so far. The problem is we do not know the true extent of this thing, and that's why now you see the Ministry of Health is going out to test all healthcare workers, to test people who are working in those quarantine facilities, so that we are able to know as much as possible what the true status of this pandemic is in the country. Michelle.
All right, and Dr. Masi, restriction of movement is just one of the measures put in place by the government to help flatten that curve, and so is wearing of masks, which is now mandatory in public in Kenya. But talk to us about the type of masks being donned, and many of them being sold on the streets by hawkers. Some just really being made by tailors, some making their own masks at home. Are these masks safe and helpful in helping curb the spread of coronavirus?
Well, Michelle, I think we have seen all manner of masks. I think the most absurd for me was the one that was done from crochet, where somebody has just knitted something and, you know, pasted a piece of cloth inside. And this is a point of concern because those are as porous as not having a mask. In fact, they would just hold as many bugs, as many germs, dust, whatever, in the area of the nose and the mouth. So I think here what we need is the Ministry of Health, the Ministry of Industrialization, KEBS, to come out and give the standards in which people should make masks. To tell us who should be selling these masks, because as you said, when you drive along the roads in Nairobi, when you're walking in the streets, there are people walking around with all manner of masks, hawking them. There are people who are trying them on and putting them down to see which one fits. So I think we need the Ministry of Health and the other ministries involved to really come out and give us the standards of what kind of mask can be used in the public. The second clarity that we need from the Ministry of Health is we know that globally there's a shortage of some of these personal protective equipment across the globe, and it's a good initiative that they want us to start manufacturing this equipment. But for the few that we have, we should be able to prioritize for the healthcare workers, because those are the ones who are at most risk, because they are coming in contact with suspected cases of COVID-19, people who do not even know that they are suspected cases of COVID-19. And if they do not have the right kind of masks, good quality of masks, then it's exposing everyone else in society to the risk of getting COVID-19, because they can easily get this infection from their workplaces, and then when they come out to the community or when they're interacting with the rest of us in the community, then they can quickly transmit this particular virus to the rest of the community. So everything else we will be doing will be, there'll be zero gain from everything else that we do. The other thing that we need clarity on is, as I said, who should sell these masks and where and at how much, because we're seeing that a box of masks that was initially about 200 shillings, 400 shillings, now retails for about 7,000 shillings, meaning that even those who must use masks at all times, like the healthcare workers, are not able to afford this mask, because now there's a big demand in the market for this mask. So that needs a bit of clarity from the government. And now for the public, it's important to know that the mask is that just one measure of the many measures that we need to put in place to prevent ourselves from getting COVID-19. Yes, the mask will protect you at that point, but remember that you should not stop the other measures, like washing your hands with soap and water. If you cannot access soap and water, use an alcohol-based sanitizer. Clean surfaces. The mask is not a substitute for all of these other measures, much as the government is putting even fines for people who are not wearing masks. Remember that all these other measures are key in preventing you from getting COVID-19. So do not have a source of protection from the mask yet, and then you forget the other protective measures or the other measures that have been put in place to protect you from contracting COVID-19. Michelle.
Many thanks. That is Dr. Masi Korir with more perspectives on the efforts to flatten the curve in the country. Many thanks, Dr. Masi.